bipolar, is there any, besides medicine, which we know has been used in the past, is there anything a psychologist could do to handle the situation better?
The number one thing with bipolar is psychoeducation. Bipolar is so kind of counterintuitive. One day the person is elated. A day or two later, or maybe even in the same day, they're dejected. Also, one day they're in a particularly aggressive, irritable state. A lot of times it has a grandiosity attached to it, where they, think that they're brilliant and they've got great ideas. So it really has so many ramifications, so many symptoms, that a lot of times people just don't get it. They don't realize that their child, their parent, whoever is bipolar. So psychoeducation, teaching the patient and their family all of the parameters of the illness, because it's so complex. There are so many different symptom complexes, and some of them are opposites of each other, like elation and dejection. So psychoeducation, I think, is primary. When you do the psychoeducation, once they have a sense about that and they're learning, then you can develop what we call signals. So now they start to know, if they start thinking that they're brilliant, or they start thinking they've got a great idea, it could be that their illness is taking over. So you get a lot of signal points for these people. Likewise, if they start feeling blue and dejected, that's a signal point. Then you teach them mood management. First of all, when you're in those moods, again, they have to be in some kind of professional care with bipolar, unless it's in remission. And then they can work on mood modulation. Okay, we know this is your mood now, and then you're going to, again, correct those beliefs. It's very complex.
What's the youngest age you would label a kid bipolar?
Well, I don't like to label any kid bipolar unless they're at least 10, 12, 13, but we're getting kids labeled 4, 5, 6 years old bipolar these days.
Is something happening, or just more awareness?
It's more awareness, but there's more awareness, and because of the pattern of it running in families, they start to see 3 and 4 generations. So that now, not only could you extrapolate, but you might even know now, we're getting to the point where grandpa was actually on lithium, and mama is on another medication, Depakote, whatever. So now they've got a child, and so when that kid's 3, 4, 5 years old, and the kid has particularly violent, rageful temper tantrums that last for hours at a time, it's definitely a likely possibility, but it's just, to label a kid that young bipolar, it's you still treat them, you still have to treat them, but I don't like to label them that young.